Over the past several decades, Kenya has become an economic and innovation hub in East Africa, growing from all sectors including healthcare. Kenya's healthcare sector is one of the most dynamic in Eastern Africa. Of importance to note is that rising income and population over the last decade have fueled rapid growth in the health sector, particularly among for-profit providers.
Poor health consumers are actually paying more than those who are insured or had higher incomes. Why? Because they had poor quality of delivery. They'd end up going repeatedly to get the same problem treated. We discovered a phenomenon called the poverty penalty. Because the problem wouldn't get solved, they'd pay again and again, they'd lose work and end up actually spending more.
The desire to improve operation of public health services and facilities and to expand access to higher quality services are among the key factors driving governments worldwide to use the public-private partnership model, whose results include more potential partners for governments as private healthcare sector matures and a significant percentage of the poor seeking affordable quality healthcare at for-profit health services.
The private sector, development partners, public sector, counties, faith-based organizations, we should form a strong partnership, and it's only then we will achieve universal health coverage in Kenya.
Over the last 10 years, interest and experience in leveraging the private sector to achieve national health goals has grown. In response, DFID designed the Private Sector Innovation Program for Health, PSP4H, to carry out action research into how a market systems approach might benefit pro-poor health interventions in Kenya.
We have adopted a Making Markets Work for the Poor approach on this program, otherwise known as M4P. The key principles of M4P are that it must be pro-poor, facilitative, systemic and scalable.
Our research informed us that if we target the private sector, the pro-poor can actually access quality, affordable healthcare.
As a first initiative, PSP4H had to map out 273 donor health programs in Kenya in March of 2014 and identified 7 underserved areas within the Kenyan health market where market systems development programming would work best. They were
non-communicable diseases, supply chain, diagnostics, low-cost delivery models, healthcare finance, e-health and m-health, and maternal health.
Through PSP4H, Cardno employed the principles of the Making Markets Work for the Poor, which seeks to sustainably reduce poverty by identifying and addressing where markets work inefficiently for the poor.
Some of the key innovations we came up with were networks. We found that it was easier to bring these people together, running their own business as theirs and enlightening them on what they're supposed to do. Taught them on business skills training, which was lacking, and we directed traffic towards their business. And by doing that, we eliminated a lot of quacks. And you found that the working poor, the low-income earners, at the end of the day, got information on where to get the right drugs.
PSP4H partnered with the Kenya Pharmaceutical Association, KPA, to develop the FarmNet network of affordable quality-assured pharmacies with 323 outlets in 7 Kenyan counties as of late 2015. FarmNet outlets are owned and operated by independent KPA members.
Our medications and everything and all the services, they are of good quality.
PSP4H has been an innovation center for private health sector investors with innovative ideas. The objective is to foster sustainable healthcare business models that are win-to-win and profitable for business while delivering better value to the working poor.
We've known PSP4H for the last 3 to 4 years. They came in helped us market. We had few billboards put across the city. We had many people calling to make inquiries about our services. Right now as we speak, we've grown to an average of around 55 patients. That's in a span of 2.5 years.
PSP4H is assisting PS Kenya Tunza franchise and other newly established franchises like FarmNet, LabNet, Jacaranda Hospital and Birthwise network providers to strengthen their business skills.
Initially, we used to see 5 to 10 patients. That's before the LabNet issue. But now, currently, our numbers ranges from 15 to 20 per day. We have actually managed to win most of the people confidence.
The business models were cash flow management, inventory management, and customer care. And you realize customer care is a big issue in health service delivery.
Eunice gave birth here, and she gave birth in twins, both female, alive, and she gave birth SVD, whereby there is no any operation which was done.
In capacity building of the members, we have taken much of the load which was on the public hospitals. The rate of maternal and neonatal death has reduced significantly.
The program had 6 ongoing pilots with a total budget that is less than a typical DFID Challenge Fund grant, showing that the M4P approach to healthcare can offer development funders outstanding value for money.
TOTs would support the e-learners, maybe through the practical sessions, the proper use of an inhaler, an nebulizer, and even coming up with innovations for nebulizers in case a facility does not have.
The mandate of the Asthma Care Improvement Project, ACIP, is to develop and implement a sustainable asthma initiative targeting low-income populations in Kenya. The project aims to build on existing asthma care partnerships in the public and private health sector, subsequently leading to the reduction of the burden of asthma care and management in Kenya.
Overall, PSP4H has shown that there are sustainable for-profit healthcare models that can be used in development, and the private sector plays an essential role in bringing quality healthcare to all. And overall, it came up with some sustainable business models that can be used in the future to bring for-profit healthcare to the mass market in developing